Hello and welcome to the Global Summit on Economic Abuse. If the contents of this session raise any issues for you, we encourage you to take whatever steps you need to prioritise your own well-being. If you'd like to reach out for support, you'll find a link in the chat to the No More Global Directory, a global directory of specialist domestic abuse and sexual violence services. Hello, I'm Julie Kun, joining you from the unceded lands of the Wurundjeri people of the Kulin Nation. I'm acting CEO of Women with Disabilities Victoria and a consultant with a focus on intersectional evidence-informed strategies to combat economic abuse and promote social justice. I'm also the current chair of Gender Equity Victoria. We know that economic abuse disproportionately affects women with disabilities. In Australia, 1 in 4 women with disabilities have experienced economic abuse, compared to about 1 in 6 women in the general population. Women with disabilities also face additional and compounding barriers to financial security. Let's explore what needs to change. I would like to welcome our panellist, Bonnie Drayton, CEO of disability rights nonprofit Dawn, Canada's feminist disability organisation, celebrating 40 years and still rising. And Dr. Ramik Doge, past president of the Federation of Medical Women of Canada. Okay, to Bonnie. From your experience, what are the most significant systemic barriers that prevent victim survivors with disabilities from recovering their financial safety after economic abuse?
Well, first of all, thanks very much for inviting me to be part of this panel. And I want to give a big shout out, of course, to Messi and her organization, the Canadian Centre for Women's Empowerment, who's a dear friend and partner of ours in this work. I would say, actually, Julie, that currently there's relatively low recognition of economic abuse more broadly in the gender-based violence sector is sort of the first problem. You know, that fragmentation is there at the front end already. In a sector that's struggled to include the needs of women with disabilities, that's kind of where we are right now. Insufficient consequences and oversight by the financial sector in general, with even less attention on women with disabilities, is already, like I said, something we know is the issue. There's been some big movement here in Canada in the most recent announcements in our from the finance minister, and again, the possibility of a new in the Department of Justice here in Canada, the possibility of there being a new division that will be actually focused on this. And I think I'll credit Messi and her organization with lots of the leadership in that regard. But having said that, we are in a world where leaving women with disability behind is in so many spheres, including, again, many of the things that facilitate economic abuse, including AI, online tech facilitated gender-based violence. Really, like I said, we've been left behind so much in the space where much of this is taking place now. So with less in the way of peers and peer support, from isolation, from deep poverty and limited access to safe, affordable, and accessible housing, really, what financial safety are we talking about here? Because again, women with disabilities have such high levels of poverty. This is already where we are. Dawn Canada actually intervened in a Supreme Court case last year that attracted the attention of many feminist reformists and law clinics from across the country. But it was actually our factum in this case called Alawala v. Alawala was considered one of the most important. And I know intersectional discrimination is dear to both of your hearts. And of course, that was one of the reasons, is because the work that Dawn Canada did in that case really pointed to that intersectional reality. We'll share our factum, in fact, with participants I understand there's a place where we'll be able to leave our resources for folks. But I was going to say, I think, really at the top of this list, we've got systemic ableism, and then you drill down past systemic ableism, and we've got lots of attitudinal barriers. And really, a violence against women sector that's under-resourced to begin with, that's struggling to figure out how to include us.
That most definitely. And Renee, I've got a follow-up question for you. What about in your experience? What are some of the barriers to financial security after economic abuse?
I think many things, as Bonnie has also already mentioned, as we see systemic existent in the healthcare system, in the justice system, we're not even addressing the social determinants of health when looking at especially gender-based violence and survivorship, when we are trying to look at one of the most important barriers to leaving a terrible situation for our marginalized and vulnerable populations. One of it is definitely economic security, and the definite vast majority of women that are experiencing gender-based violence. And as Bonnie has alluded to, the statistics are worse for our populations with disability, making it even further more difficult to leave a situation, a violent situation, or seek help. I think many obstacles are that security piece. If you don't have a place to live, you don't know how you're going to feed your children, you don't know how you're going to make your rent or secure any sort of funding in order to escape the situation. That is one of the most significant barriers for people leaving a situation. So, and the other part is recognizing financial abuse. I think it's been really until recently we're seeing some of the language change. And thank you to Messi and the Canadian Center for um, Women's Empowerment. I think definitely putting it on the map and actually using the language and the cultural nuance that exists around the language and the framing. And more often, as we know, it's a feminist issue, but we have to be able to advocate for all of us. And especially with the healthcare sector, if we don't see all of us in it, we can't create a better system that exists. And right now, far too often, I still see systemic ableism, which is hindering the healthcare and well-being of a lot of our citizens and our patients. And if we don't understand the barriers for people to actually have safety, then we're really scratching the bare minimum of the surface of what we can provide, especially in healthcare and situations of justice as well.
Thank you so much to that. And I'm going to go straight back to you, Ronit, for another question. How can disability support systems and programs be reformed to ensure continuity of care and financial support when a woman leaves an abusive partner or carer?
I think we definitely have to go to the institutions and we have to go to the sectors in which they're responsible for the health and well-being of people. And so when I'm saying healthcare, education, and justice, I think those are desperately in need of reform. We need education piece. We need people to be able to challenge what the current status quo is, especially when giving the information and really putting it on every agenda. I think being inclusive and ensuring that we have a voice of representation matters, and an intersectional voice always matters. When the decisions are made and where the decisions are made, you need to ensure that every voice is heard, and especially our most marginalized or vulnerable populations need to be considered first. I truly believe that if we have our voices and are inclusive about what needs have been unmet by our most marginalized populations, then we can create extraordinary systems that can withstand and benefit all those involved.
Absolute snaps to nothing about us without us there. So thank you for that.
Can I just jump in for one sec, Julie? Which is to say that I want to make it clear too that one of the realities, certainly here in Canada, is that there are no frontline services for women with disabilities in communities. They don't exist. That is the bare fact. A country like Canada, a G7 country where 30% of women live with a disability. So fully 1 in 6 Canadians is a woman with a disability. She has the highest rates of poverty, the highest rates of gender-based violence, and no frontline services. The partnerships between the disability services and GBV services is the exact focus of Dawn right now in terms of trying to be a catalyst to bring these two sectors together.
Thanks for that. And exactly the same in Australia. No frontline specific services for disability. I'm going to move on to a bit of a different subject. So this is for you, Bonnie. What role can employers play in supporting financial recovery for women with disabilities, especially considering trauma, caregiving responsibilities, and workplace discrimination?
I was really interested when I heard the question, and I've really thought about it. And I wanted to start with saying that what we want for women with disabilities is the same thing we want for all women. Because, again, many women with disabilities are invisible in employment, and many people around them do not know they have a disability. And many women will not disclose that they have a disability in the workplace. So, creating a safe workplace where people feel both culturally safe and able to seek support is, of course, really important. So start with ensuring that your workplace has a culture of inclusion. And like all women, women with disabilities need to know that their employer and their peers will give them the same level of support they would to any other woman experiencing abuse. Add to that the risk to the millions of women with disabilities who are not employed, because I want to say again, the unemployment rate of women with disabilities is devastatingly high. And as such, the attachment to the workforce is so precarious that the situation in terms of financial abuse, while it arises, often arises outside of the employment sector, where women are receiving social assistance and very minimal funding and still experiencing extreme financial abuse. I had a woman call me once in the middle of the night, both of you, from rural Prince Edward Island, to tell me in a whisper that her partner had left. He'd been holding her for a week without providing personal care or food or water to her, so she would sign over her social assistance check. She called legal aid and they told her, well, if you come down to the office and make a report. So, I mean, it's a great question, but like I said, it's not the first question, sadly, for women with disabilities in Canada. I wish it was. I wish it was about employment and that situation, but it goes so much deeper. Many women with disabilities don't have bank accounts.
Yeah, there's so many barriers there,
You know?
isn't it? So, Monique, for you, how can we ensure that women with disabilities are represented in policy design and leadership roles to drive inclusive reform?
I think, as you mentioned, Julie, nothing for us without us. And I think we have to be very intentional here. With any other inclusive reform pieces, we have to be proactive and we have to ensure there is a seat at the table. How do we ensure that there's a seat at the table? We have to increase our awareness. It's not that we're not there. We have to put pressure on organizations and institutions and remind them that the care that they're doing or the decisions that they're making need to be inclusive in order to really, truly create a system of care that is protective, effective, and is doing the right thing. I think quite often we are being left out of these conversations that have been had, and many tables at which I've sat that are not having any components of intersectional feminist frameworks, where I think that's the ideal situation, that each sector, whether it be health or justice or education, needs to be populated by ensuring there's inclusivity at the top, as well as the sprinkling of decision making that goes into the ground and the patient populations. I truly believe that even thinking about a solution, such as when I've just heard Bonnie speak about this situation, my heart goes out to these people that are so disenfranchised from the system and even able to get help. We need an emergency response system, like a social services response team that would go out and be able to advocate for our, populations. And I truly feel that as we have an emergency response to deal with medical emergencies, these are emergencies, gender-based violence, and especially with people that are living with disability and have no access to having financial security or even their personal safety. We need to do something. There needs to be a solution in which we create this opportunity, and that only happens with the voices being at the table to ensure that both our politicians and our nonpartisan institutions are being very inclusive in how they are listening to what is actually happening on the ground. I think, Bonnie, your sharing of the data and what is actually out there needs to resonate with all of our communities, and it goes all the way up from our municipalities to our provincial, federal, and global. And we need to continue to put that full pressure, but we also need to have significant allyship for that permission to happen.
Canada's a G7 country, and that's our data. And
Yeah.
instead of sort of sitting on the QT around that, as a G7 country, we should understand that that means it's higher in other countries, right? To start with. And really, Julie, because you focus on intersectional practice and you train and consult in that area, you and I both know, right? Intersectional practice doesn't happen unless you make commitments and resources to that effect. In 2020, on our teeny tiny budget, the next thing that I did when we hit our 35th year in service, I created 2 new positions, my Director of Indigenous Initiatives and my Director of Black Community Initiatives. It's 2025, and these women have been on my team for a few years now, and we are deep into intersectional practice, and we are waiting for the rest of the feminist community to catch up with us.
Right.
That is such a fantastic thing to hear, and we need far more of it. And you're sort of going into the last question I have for both of you, and you may want to talk a bit more about that or something else, Bonnie. But could each of you, and I'll go to Bonnie first, share an example of a program or initiative that has successfully supported women with disabilities in rebuilding financial security after economic abuse?
Well, I was going to say, I wish Messi was here, because I was going to say we don't do direct service, but when we've had any situations like that, we've actually referred them to Messi's organization. But I was going to say it really does come down to building out and understanding that we need a grassroots peer support led by women with disabilities movement, both in Canada and across the globe, that is supported by the larger feminist disability and, of course, municipal, territorial, and federal governments. And, this denial, deny, is not helping. When I started in my job, the statistic in Canada was 16%. And in 2020, it was 24%. And like I said, in Canada, G7, we're at 30% now. And that's before the intersectional lens. So acting on the data, creating, like Ramita said, new policies, right? New legislation, and the kind of mechanisms that we're finally starting to see here in Canada, thanks to the activism of the feminist movement, and again, leaders like Messi in this particular area. I know we will get there. But, it starts with, like I said, people acting on the facts, act on the data.
So true. Ramneek, I've got the same question for you. What would you like to say about an initiative?
I wish I had more examples, especially being a G7 country. I'm actually quite embarrassed and disappointed at how little we've come. But I do want to recognize Bonnie's organization, the Dawn Foundation, and I want to recognize Messi's foundation, CCWE, because for me, these are the two that have actually made myself and my organization mindful, and to ensure that our intersectional frameworks are inclusive and that we do look at barriers for all of those that are facing systemic ableism. And for us to recognize, I am representing the Federation of Medical Women of Canada, and for us to understand our partnerships as well. And as Bonnie alluded to, we also have engaged our Indigenous Physicians of Canada, and we have a partnership with our Black Physicians of Canada, because we need them to have seats at the table for them to make us aware of the very specific issues. And also, we also have somebody with disabilities that is helping us to frame what we're doing and the work we're doing to ensure that our rollout is inclusive. So being very intentional about these decisions, but I really wish it's not just these two organizations. I really hope for our federal government to earmark some substantial funding for our most vulnerable populations. And I really think they need to put their money where their mouth is. And I know there's been a tremendous effort recently about bringing monies forward, but really trying to help within the framework and helping guide, and especially the principles that Bonnie and Messi have been working under, using their guidance and their consultancy to be able to advocate further and to ensure that it's a successful win, not just throwing money without any, guidelines or frameworks for someone, especially with such expertise, to be involved in that work.
I'm going to add one more thing because I think it's really important, and that's
Go for it.
curriculum reform.
Yes.
The academic understanding and reality check that needs to happen is massive. Schools of social work, medical schools, social work schools, all of the so-called professionals, right? Because again, you didn't get any of this information when you were getting your medical degree, did you? No.
Nope.
You found this out through practice. And like I said, that the government bases a lot of their decisions on what they hear from the experts, and they regard those folks as the experts instead of us. And I'm sorry, but they are so far behind in all of the schools in terms of the curriculum. Every one of them, the schools of business, law, medicine, all of them need reform, because this is a structural problem that is linked to colonization and to so many other things that women experience thanks to misogyny.
Yes, decolonize the systems.
Yeah.
Yep.
Yeah, thank that, and that is a great place to end. Decolonize the systems. Let's remove the ableism. Thank you so much. I really loved how you both centered so much that it is the voice and it is the knowledge of people with disabilities that needs to be brought forward. We are so often shouting from the rafters and then only to be told we didn't know, we didn't hear. And you've just provided examples of the deep work that is being done. And I'm so grateful for your time and your guidance, which is really going to assist, I think, everyone listening to this session today. So thank you.